This. Joining me right now is Dr. A.K. Grover. He's the chairman of ophthalmology department at the AIIMS. Good morning, Dr. Grover. Thank you very much for speaking to us on Republic TV.
Good morning, Dupuji. I'm glad that you're taking up this important subject, which has become a really important epidemic affecting lives. Just a little correction, I'm chairman of Department of Ophthalmology at Sir Gangaram Hospital and Vision Centers. The wave has hit us very hard. We normally saw about 3 to 4 cases in about 3 months, but now we are seeing almost 3 to 4 cases a day. At this moment, we have 19 cases admitted in Sir Gangaram Hospital, and as a part of a research group that has taken up a prospective study on this from the start of the COVID epidemic last year, we have recorded over 31 cases earlier and another 10 or so in this pandemic in that study so far, which indicates that the levels have really gone up high, and this is borne out by speaking to all our corresponding colleagues in different parts of the country. They are seeing a huge number of cases, which is life-threatening and sight-threatening.
Right now, Dr. Grover, what essentially is the line of treatment that patients should follow, and what are the symptoms that doctors should be watching out for? Because as you yourself said, we are seeing a large number of cases. At least Maharashtra alone has reported about 2,000 cases of mucormycosis.
Yeah, it is essentially a disease which involves the nose, then the air sinuses surrounding the nose or the paranasal sinuses, and then it extends to the orbit, which is the area of bone and tissues behind the eyeball, which supplies all the nerves, all the vessels to the eyes. And it is here that when the disease affects the blood vessels, which supply the eye as well as all the tissues around are inflamed, that the vision gets very rapidly lost. And the risk is that it extends very rapidly. It gets on to involve the other eye. It goes back and involves the sinuses in the brain and then the brain tissue. And then it becomes life-threatening. Loss of bilateral vision can occur very rapidly in this disease. And we know that this is being predisposed by the decrease in immunity that occurs with the disease, with the medications that are being used at the same time, which lower the immunity, which are essential for the treatment of the COVID disease, and also because of poor metabolic control of diabetes, which is a major predisposing factor. Of the 31 cases that we've analyzed, 29 were diabetic, and uncontrolled diabetes is playing havoc. So that is where a rational use of steroids, drugs like tocilizumab, and a very, very meticulous control of the diabetes is important. This is an organism that doesn't come from outside. It is residing in our nasal mucosa or in the sinuses. And it is the lowered immunity which allows this disease to spread very rapidly and overcome our immunity to cause the nasal and the brain disease and the eye disease, causing blindness and death.
Now, Dr. Grover, one of the concerns in being able to, have a line of treatment is that these antifungal drugs are extremely expensive. We've seen hospitals and medical boards come out and say that, perhaps rationalization of prices could help go a long way in fighting increasing number of cases. What's your view on that?
It's very important. The supplies themselves are drying out because we are seeing a number of cases. The drugs that we use are the intravenous ribosomal amphotericin B and also some of the oral antifungals like posaconazole. And the short supply of these could play havoc. The cost of these drugs is very high, and these need to be given intravenously over a period of a month, month and a half, which is prohibitive for families. It always has been. And increasingly, it has become prohibitive now, and it's become more difficult to procure these drugs for the patients. And that is where good government control on the supplies and on the prices would be very important.
Right, Dr. Grover, thank you very much for speaking to us on Republic TV and taking out your time.
Thank you so much, Nupurji.